So we're going to give you 60 seconds each to run through yourself, who you are, a little bit about your company and opportunity. And again, maybe your superpower if you want to do that.
Yes, I'm Dimitri Yanikopoulos, the Chief Transformation Officer at Aidoc. It's a pleasure to be here today. Thank you for the opportunity. We started in the diagnostic imaging world. We're still very much there with 17 FDA-cleared Class 2 medical devices, as well as a half dozen partners integrated into our AI operating system. Our AI operating system is used at thousands of health systems across the globe, and that's all since our founding in 2016, which was really a perfect time to start in this space because we were really able to capitalize on the most recent advancements in AI, convolutional neural networks that led to all these imaging-based capabilities, but also things like natural language processing going through a refresh. If I think about our superpower, it's twofold. First, we recognize that an AI algorithm by itself is technology. So we leverage AI to identify where we should apply the AI. Looking at the raw images, for example, to identify, hey, it's unexpected that this has the heart in it, but it does. So let's look at the heart. And then activate the right care team from there based on what we see. And then finally, on that activation side, actually integrating into the clinical flows, making sure that this technology that's great and can provide all this data can actually be used as part of that patient's journey through the institution to really facilitate their care and get them to the right doctor at the right time, in the right way.
Summarize the key message that you would tell in this very short period of time you have of your clinical and economic value propositions, and make sure you tell us if you're reimbursed or if you're just, an enterprise sale that's going to just fit into the overall economics, and explain that business model. So it's really ultimately business model that we're kind of going after here, as well as the benefits.
Foundation element of our approach, you can look at our licensing style. It's an enterprise license. We don't just go and install at the tertiary or quaternary medical center, hoping that those patients will be the ones that benefit from AI, but instead approach the enterprise. And how can this be leveraged across the entire enterprise? Present in the community, it's as though you present at the University Medical Center. There really shouldn't be that level of variation, and we think it's extremely important to apply AI using that same methodology. We are a SaaS license, so an annual fee, not under a reimbursed model. We do have some applications that could qualify, but as it stands, not in that route. And I'd say from an outcomes perspective, if you look at some of our solutions, one good example is the pulmonary embolism response team solution. It leverages literally 4 different AI applications to identify, is this a patient that should be brought to the attention, have a team activated to care for them. And PEs are patients that are oftentimes labeled tweeners. Like they aren't really the most acute, they're not the least acute. They're in that middle spot, so they don't always get the highest attention. By having those types of solutions implemented, Methodist Healthcare in San Antonio, HCA joint venture, found a 55% reduction in their ICU length of stay. And that's device agnostic, because there's also a lot of new devices coming around. Cedars-Sinai did a similar analysis. They found 23%. They went so far as to value the cost savings of that to $504,000 for those patients that are receiving advanced procedures. The other key element is really, how does this fit into the long-term management of these patients as well? So Yale, we've been partnering with their vascular surgery team, and they've shown that they've been able to decrease the time to repair for patients with 5-centimeter or greater aneurysms by 75%, taking it down from 278 days down to 58 days. So, really driving fast care and impactful care. Ultimately, that results in more procedures. That results in less complicated patients from both treatment and outcome side. So really important to look at that holistic benefit and identify how it actually fits in the workflow, meet with the med exec committee, establish scope of care, like all those boring things that ultimately will hinder impact of these types of solutions if they're not done, and then work with the partners to quantify the value.